So let's pick up the question number 1 from the paper which was uploaded on 11th of October 2025 on NextSaviours series and under the name of Sarvsaksham test series for the medicos. Now the question is that the 52-year-old, that means elderly man, coming with the progressive weakness. Now the moment we hear the word weakness along with the fatigability in a 52-year-old man, then our reflex answer tend to become myasthenia gravis. But here is the twist. If you read the line further, that it is getting improved with repeated muscle use. Now, as you know, that post-exercise facilitation is classical for Lambert-Eaton syndrome. On the other hand, in case of myasthenia gravis, it worsens with activity. So that is point number 1. Now, if you look at the point number 2, like the dependent reflexes are found to be reduced, as you already are aware of the fact that in myasthenia gravis, that BTRs, it remains normant. Why in case of Lambert-Eaton syndrome? So it is depressed because that's acetylcholine is being released. So these two factors are pointing towards that the answer could be the Lambert-Eaton syndrome. Now there is a third clue in the question, and that is that the CT chest shows a mass in the lung apex. And as you already are aware of the fact that the cancer which is associated with Lambert-Eaton syndrome is a small cell carcinoma of the lung. So what you have to remember is that Lambert-Eaton is a paraneoplastic syndrome which is mediated by the antibodies against presynaptic calcium channels, which decreases acetylcholine release at the neurovascular junctions. So putting it all together, it is not myasthenia gravis, it is not poliomyelitis, and definitely not the Guillain-Barré syndrome, because in Guillain-Barré syndrome, there has to be a symptom paralysis along with the areflexia, and it usually follows the infection. So the right answer for this question is Lambert-Eaton syndrome. If you look at the explanation which is provided to you in the app, that's serious, this is obviously a trap many fall into, that the weakness plus fatigability often screams myasthenia gravis, and when we are sitting in the examination hall, we tend to be in a hurry and marking the answer myasthenia gravis for the same. But here the strength improves with the activity, post-exercise facilitation, and the reflexes are depressed, so that is suggestive of Lambert-Eaton. Now it is a paraneoplastic disorder which is often associated with the small cell carcinoma of the lung, where antibodies attack the synaptic calcium channel thereby reducing acetylcholine release. So in contrast, myasthenia gravis, it worsens with the activity and has non-blunt reflexes. So the answer for this question obviously is the Lambert-Eaton myasthenic syndrome. Every day from 6:30 to 8:30 a.m., a fresh clinical paper will be uploaded free of cost on the NextSaviours app. So Saviors, no confusion, no regrets, just practice, precision, and progress.